calculate the scan length. This translates to 41 millisievert just by simple conversion factor. I'm not going to the complicated. Whereas this arterial venous and delayed phase had a 3 scans, this translates to 58 millisievert. And we are all hearing about all these concern in the BR7 of anybody getting more than 100 millisievert to have a statistical risk and so forth. This patient got 58 millisievert in one shot, and lot of the triphasic or kidney study patients get multiple of these CT scans over a period of year or a couple of years. So sometime you don't want to look at, but if you look at randomly in your patient charts for a couple of months, you can immediately see some patients getting multiple of these scans. And if the back of the envelope, if you calculate, these they are getting more than like 300, 400 millisievert. One of my radiologists called recently about a concern about one particular patient. This is a female. She has a spondylitis. This person was getting the 150th scan in the last 6 years. So that is the concern where whatever the efforts we can reduce the dose, take the steps to reduce dose, will have an impact on the patient in a long term. That's the whole purpose. I'm not worrying about I'm not too concerned about the controversy with respect to the stochastic risk and so forth, but the amount of dose itself is an issue which we need to address it rather than arguing about the accuracy of the stochastic risk. We need to pay attention about how we can take to reduce radiation dose. In that regard, there is a new development with the manufacturers providing what is called as a virtual non-enhanced image. Basically, what they are doing is like they take the raw data and instead of doing another scan, they can virtually reconstruct. Basically, it is called as true non-enhanced arterial and delayed phase is what typically done. With a dual energy CT, this is one of the major applications which is going to help us in the clinic is you can reconstruct a third set of image, what is called as virtual non-enhanced image.